Welcome, Brad.
Thank you.
Tell us what a patient navigator is and sort of the philosophy behind that.
Well, navigation itself, these days with the complexity of healthcare and so many different providers, especially around cancer, where you've got medical oncologists, radiation oncologists, surgeons, and your own family practice physician, there's a lot of handoffs and a lot of complexity as you move from discipline to discipline. And so the navigator really helps the person on that journey as they go through both with all the providers as well as all the departments within the hospital.
We are actually going to meet in a video clip your patient navigator, Meg Schrader, in a few moments. But tell me some of the interesting things that you find her doing for patients once they've had a diagnosis of cancer.
Well, it's really unbelievable the things we thought that she was going to do, with coordination and trying to, again, navigate the person through the complexity of the healthcare system. But she does so much more beyond that. She's actually a breast cancer survivor herself, so she can speak to this both from the side of knowing how things operate within the health system, but also knowing how it impacted her, which is not to say that everybody's journey is the same, but it does give some ability to empathize with the person having gone through it herself. So she can be upstairs working in the surgeon's office on the time that the person first gets their diagnosis back from the surgeon. She can be with the person as they go into surgery and prepare for the surgery that they're going to have. She's in there and she actually takes notes the very first time that she's in there with the patient, and take notes of everything the person, both the nurse and the physician, says, because you're so overwhelmed even then when you're hearing this news, that she copies everything down and she hands that back over to the patient so they have a record of what was said and what was discussed during that visit.
And then she can, with some medical expertise plus her own experiences, walk back through with the patient their potential options and that sort of thing.
Right, because again, you're having all of this come to you, and again, we try to coordinate things, but again, you're seeing one physician that's focused on surgery, you're seeing another physician that's focused on radiation therapy, another person, the medical oncologist, that's looking at the kind of the whole system, and it's a systemic disease, so they're thinking about the chemotherapy or hormone therapy and how it affects the whole body, and putting all those together and making it kind of fit is where she really comes in and kind of walks the person back through it. And again, it is about the choices that the patient still has to make on their own and their own unique circumstances that they have to decide what's going to work. One person may choose a mastectomy, another person may choose a lumpectomy and radiation therapy.
Very good. Well, again, we will see Meg in just a few minutes, but as we wrap up, tell us about the recent affiliation with Duke Medical Center and what that will mean of care for people in the Valley from Augusta Health.
Sure. We entered into this affiliation agreement, which is basically they're helping us in some consultory manner. They're focused on research. They're focused on education, as far as, again, education for physicians, staff, as well as the community. They're focused on, again, raising the bar on our clinical quality, which is not to say that our quality is not good now, because we are a accredited program both from a National Breast Cancer Center as well as a comprehensive cancer center. But again, looking at the standards that are out there and benchmarking ourselves against those Duke standards.
Now let's take a look at what a huge difference patient navigator Meg Schrader made in one patient's treatment for breast cancer.
We develop very close relationships with patients. I have some patients that I touch base with once a week. When patients are going through chemotherapy, a lot of times I try to get to them to at least say hi to them once a week if they're coming here for labs to be checked, or I try to make it to their chemotherapy appointments just to touch base. I'm kind of sometimes the anchor that really binds them through the entire system. So when they go from their surgeons to the medical oncologist to the radiation oncologist, I'm a familiar face that's there.
We sat after that biopsy for probably an hour and just talked and cried. And that was the beginning of what I think was a beautiful relationship. Meg quickly became not only part of my treatment team, but she became a good friend to me.